Good afternoon, everyone. My name is Kanchaporn Nopkaomeesaeng, a third-year medical student from Phramongkutklao College of Medicine. I will be presenting my research project on the topic of evaluating the effectiveness of IMRC participation in developing global health competency among medical students in Phramongkutklao College of Medicine. So, let's start at, does anyone knows about the global health? The global health is a multidisciplinary and multi-sectional field of research and practice aimed at improving health worldwide. And the global health competency covers five topics, include global health epidemiology, environmental, health system, and others. Although Although global health has many advantages, there still have some gaps. For example, gaps in preparedness among medical professionals in the COVID-19 crisis. As you can see in the graph, you can see that there are some countries that have problems in this crisis. Global health challenges need leaders who can work across culture and interdisciplinary. But medical education focuses on clinical knowledge, which means that global health skills are often overlooked. Because global health is considered important, so extracurricular like IMRC was organized. But how can we know that IMRC can develop global health competency or not? Therefore, our objective is to assess the effectiveness of IMRC participation in developing global health competency. And this is our methodology. We use a mixed method approaches. And the first thing is quantitative survey by 236 PCM medical students. And we use a qualitative in-depth interview by 20 students, which is 15 students had a high score and 5 students is a low score. This is our data collection. We use a Likert scale questions and open-ended questions. Under 4 topics, the first one is global health knowledge, the preparedness for global health challenges, the global health skills, and integration into curriculum. And this is our data analysis. We use a summary of central tendency and dispersion. We find the factors associated with effectiveness of IMRC participation in developing global health competency. And this is our sample size calculation. The adjusted sample size is 233 respondents. And this is our demographic data. This is our result. We calculate the result under 4 topics I mentioned before. The first topic is global health knowledge. You can see that the topics about the familiarity with the foreign global health topics, almost all of these topics has a high score, except for health system and policy in low resource setting. And you can see that the questions about the confidence in discussing global health issue is had high scores as only with peers. But surprisingly, if you can see that if this sample group have discussing with mentors that has a medium score and is lower in public forum. This is the result in the topic of preparedness for global health challenges. The results show that there is a well prepared for global health challenges in study group, indicated by high score in every questions in these topics. The third topic is global health skills. You can see that the current skills of the sample group have just only medium score, and it has a lower score in applying global health skills. However, evaluating IMRC section and recommend IMRC to other medical students has a high score. For the last topic is about the integration into curriculum. You can see that every topic has high score except for academic performance. And this is our quantitative data in-depth interview. The high score evaluate IMRC has many advantages, but the low score students think that they still lack of clarity on global health. They said that they don't know the definition and the competency of global health. Interestingly, these 2 groups of study have the same answer that IMRC still lack of application and academic performance. And this is our discussion. The discussion implied that there's still lack of application of knowledge and have a little effects on grades and lack of clarity on global health. But in the other field, the IMRC is effective. So in conclusion, the strength of IMRC has a highly effectiveness in raising global health awareness. The weakness is there has still a room for application, academic performance, and lack of clarity. The potential improvement that I would recommend you is integration global health into education and more practical framework for applying IMRC experience. And maybe we can integrate SDG into the curriculum. Last but not least, we are not just only participants in the conference, we are architects of a healthier. Thank you.
Thank you very much. A really important topic and perfect for this conference.
Thank you.
I wanted to just ask you, I was interested in how you developed the questions for your questionnaire in terms of what questions you asked.
I developed the questions by we use about these four topics, right? And we develop by cover by these four topics. We we study from the previous studies that was the questions that we could ask to cover all of these topics. Yes, something like this. Yeah, and I also have a qualitative survey that I say that I have they still have a gaps in application and academic performance. I asked them that why it happened like this. The application they say that they know about their global health, but they don't know how to apply in their daily life, like study or their jobs. And about the academic performance, most of their exam they focus on just like anatomy or medicine, but they don't focus on how to apply for the global health study. So they don't think that IMRC could help that grade that much. Yeah.
I have some question about your methodology. Please go back to slide. I wonder that why you interviews qualitative in-depth interview like it's not equal between high satisfaction and low satisfaction. How can you um, uh, choose to allocate these students to have in-depth interviews?
Okay, before we have a qualitative in-depth interview, right? We have a quantitative survey before. So the qualitative survey is by 236 PCM students, and after that, we look at the percentage of the who have a survey in a high score and the percentage of the high score. But you can see that the percentage of the I don't insert in the slide, but the percentage of the score is around 80%, is more than low score. So that's why it's a portion like this. So that's why I select.
How can you select 15 students from high and 5 students from um, low satisfaction score? Is it the equal
Um,
when you calculate into the proportion of satisfaction group and dissatisfaction group, is it approximately equal or not?
because the I select high score. I select by the 95 confidence level, right? So like the it don't have the same proportion. So I find that high score have like for example have 100 people, but the low score has just only 20 people. So I calculate the 95% confidence level and select like this.
Thank you. So another question. You say that there's some point about IMRC that this satisfaction group mentioned is it to they cannot apply knowledge from IMRC into application. So what is your plan to their comments about IMRC participation?
For applying, from my plan, I think we should integrate about the global health or SDG into the curriculum because now there are still lack of the study in this curriculum, right? So I think if we use it always use in daily life and teach how to use in the future, teach or give an example or create the workshops, I think it will help. Thank you for your questions, everyone.